ბატონო კაკი, რო გადაარქვათ სახელი თუ ან მე თვითონ გადავარქნა ერთი წუთი. ხმარო ჩართოთ.
ხო, რატო დამერქვა უცებ ესე ვერ მივხვდით.
ვიცით რა, ლინკი არის ჩვენი კოლეგის და როგორც ჩანს იმის სარეგისტრაციო ბმულიდან რომ შემოხვედით ამის გამო. ხო. How can I rename them?
I will do that now.
I'll make you co-host, Dika.
Okay.
And then you can do that.
Okay, thank you.
არა, უკვე გავაკეთე, პრობლემა არ არის.
Okay. ძალიან კარგი.
ერთ-ერთი სამი სლაიდი მაქვს და
კი ბატონო.
Hello. So, wrote sharing.
ბატონო კაკი, ქართულად თუ დაისაუბროთ. Boris.
Yes.
Can I also have the right to share?
Yes, of course.
3 slides. Okay. Thank you.
Welcome.
ბატონო კაკი, სასაუბრო ენა არის ქართული, ხო? და უზრუნველყოფილია თარგმანი. ანუ თქვენ ისაუბრებთ ქართულად. უბრალოდ მე მომეცით უფლება ორი სიტყვით რომ წარვადგინო რის რატომ ვართ აქ შეკრებილები, რომელი პროექტის ფარგლებშია ეს და რაზე ვისაუბრებთ უახლოესი 1 საათი ან ცოტა მეტი. მოგესალმებით პირველ რიგში ყველას, ვინც შემოგვიერთდით და დაინტერესდით ჩვენი ვებინარით. მე ლიკა ზაკაშვილი ვარ. Online გამოცემა პუბლიკის მთავარი რედაქტორი. ჩვენ დღეს ვართ ვებინარზე, რომლის მთავარი თემაც არის ვაქცინაცია და ზოგადად ვაქცინაციასთან დაკავშირებული სხვა საკითხები, რომელიც უკავშირდება მათ შორის კომუნიკაციის თემას. პროექტის ვებინარი იმართება პროექტის online ჟურნალისტიკა სიღრმისეულად, ასე ქვია ამ პროექტს ამის ფარგლებში, რომლის მონაწილე ქვეყნები არიან აღმოსავლეთ ევროპის ქვეყნები, საქართველო, სომხეთი, უკრაინა და ასევე ბელარუსი და პროექტის მთავარი მიზანი არის სწორედ დამოუკიდებელი მედია ორგანიზაციების გაძლიერება და ამ ორგანიზაციებს შორის პროფესიულ თემებზე დისკუსიის გაძლიერება და ეს ვებინარიც არის ერთ-ერთი შესაძლებლობა, რომ დღეს ერთ-ერთი ყველაზე მნიშვნელოვანი და აქტუალური საკითხის გარშემო ჟურნალისტებს გვეძლევა შესაძლებლობა, რომ სფეროს ექსპერტებთან ვისაუბროთ ჩვენთვის ძალიან მნიშვნელოვან თემაზე, რაც უკავშირდება ვაქცინაციას. ბატონი კაკი, არ ვიცი, ქართული აუდიტორიისთვის წარდგენა არ გჭირდებათ თქვენ, ჯანდაცვის ექსპერტი, მე ასე მიყვარს ხოლმე თქვენი წარდგენა, იმიტომ რომ ასე ამ რეგალით გაგიცანით და ყველაზე მნიშვნელოვანი სწორედ ჩემთვის.
Your background is very important indeed. Also, he worked in the Parliament of Georgia as a member of the Healthcare Commission, and Mr. Zalidze will talk about the immunization process, what we have learned so far, and he will share the Georgian example. Is there anything to be learned from the Georgian example? What kind of challenges we have, and what topics related to vaccination are currently relevant? My warm greetings to one and all. I like to share my screen to talk about my presentation. In fact, I have only 3 slides, and after these slides, we will be able to have Q&A session to make this webinar more interactive and more interesting as well. Just bear with me a minute to share my screen.
ხო, მოდით
So now we can kick off our meeting and talk about where we are now, what is the current situation. Can you see my screen? I have already shared my screen. Can you see it? No, we can't see your screen, Mr. Zaid. So am I allowed to share my screen? Am I able to share my screen? So what would you say? No. So I have started sharing my screen. So once again, greetings everybody. So this is very relevant and topic to talk about where we are currently in the world. Approximately 8.7% of the world global population has been vaccinated, has done one shot, and as for in developing countries, there is only 3.1%. These figures manifest the big gap that we have between countries, and despite the development of platform, despite UN resolutions, and despite the leaders' statement or announcement, we still have that we have very low rate of immunization in developing countries, and this is our sad reality. According to the current data, 24 million shots are done on a daily basis, and in total there is 6.88 million doses administered. And we can observe that we have a difference here between developed countries and in developing countries, and Georgia has very important challenges in this regard, and we have very low rate of fully vaccinated individuals. Some people, as for the disposition of these people, as for the attitudes of these individuals, we can see that their still hesitancy remains unresolved in our country. It is over a year when Georgia started vaccine immunization process, and Georgia launched the COVID-19 vaccination program with the goal of vaccinating at least 6% of its adult population. And also this is the share of people vaccinated against COVID-19. The data is October 25, 2021. There is green, there are countries given in green color, and this is the data of October 25, and we have here share of people fully vaccinated against COVID-19, as well as a share of people only partly vaccinated against COVID-19. And here is a list of countries, and the highest rate belongs to UAE, amounting to 96%. Also, as Cambodia is the leading country, Singapore and South Korea in Asia, and also we have a leading country from South America, namely Brazil, despite the fact that there were a lot of challenges regarding the hesitancy stemming from political leaders' attitude. We can see the figure here that is still high. Also, Israel, Britain, that reached a certain level up to 70% of adult population, and As for the rest 30%, they find it difficult to continue immunization process for this the rest 30%. And we can see that there are new variations of this viral variant, new variant of this virus. For example, a Delta variant that is more urgent than ever, that is more contagious, and the highest spread of cases and the severe outcomes is happening in places with low vaccination rate, and some vaccinated people can get the Delta in a breakthrough infection and may be contagious. And all this topic regarding this immunization process is that more unvaccinated individuals, so we have more confirmed cases we have in these countries, and these unvaccinated individuals can be source of contagious. We have today a Delta variant, but tomorrow we might have the Delta variant, Delta plus variant, and we may have Omega variant as well. And we can say that we have hospitalization and death a high rate, and based on a survey, conducted survey, we can conclude that in case of fully vaccination, especially in case of Pfizer and Moderna or AstraZeneca, we have kind of protection from getting infected. Also, there is a lesser probability for fully vaccinated individuals to be infected and to transmit or to communicate this disease to other individuals and to spread this virus to others. So probability of infection is very low, as well as transmission likelihood is very low. So this data is very important in order to explain the importance of immunization process. Definitely, hospitalizations and death rate can be reduced, and it is very critically important also to stop the spreading of this virus. And the very important step to this end, or for this purpose, is to have fully vaccinated individuals in our countries. And these vaccines protect individuals from infection, as well as fully vaccination stops spreading this virus throughout the population. And this is a very important precondition for defeating this pandemic, and to get to the condition where we will be able to better tackle this challenge. So also, as for the Georgia, there is the data of October 12, and we can see that there is no difference between October 12 and October 25 in case of Georgia, and we can see that we have 1.9, we have here 1.9 fully vaccinated, 1.9 numbers of vaccination, but only half of them is fully vaccinated. So this is also a positivity rate. We have here the latest 14-day positivity rate amounts to 9.05%. Also, we have here 7-day positivity rate up to 9.04%. Also, we have Here, the recovery rate amounts over 4,000. And also confirmed deaths. We have 46, and daily vaccination rate is 1,877 individuals. Also, we have up to 50% of fully vaccinated people in Tbilisi. And as for the recurrence or reinfection rate is very low in case of Delta variant. But so our fully vaccinated individuals are getting higher on a daily basis. And we can say that immune layer does not exceed 65% of overall population. In case of Delta variant, we are not able to be fully protected from breakthrough outbreak during the winter. So this is current situation. This immune response is very low. That means that we have a very high rate of hesitancy. So we have a fourth wave of outbreaks, and we know that we have high figures for fourth wave, and so we can conclude that we are within the permanent outbreak conditions, and because we have still high rate of confirmed cases on a daily basis. Also, we have very high positivity rate. I have already mentioned this high positivity rate amounts to 9.05%, and we are observing the higher confirmed cases, especially in Tbilisi and in Ajara region as well. Also, and based on these figures, we can say that immunization is very helpful, and immunization is a very important tool for safeguarding. Also, as for the masking, wearing a mask in public indoor settings, this still remains as a problem. However, we do understand that wearing a mask in public indoor settings is very helpful to prevent spreading of virus and to protect others as well. As to the upcoming winter, we are well aware that we will have deteriorated or worse situation by winter, because the winter in winter we have a high rate of viruses in general, or high rate of flu in general, and it will be difficult or harder, more difficult or harder to tackle the COVID-19 related challenges. There are some countries that have certain achievements. However, due to with the Delta variant, these countries still have a high rate of confirmed cases, and as for the management, they try to manage the situation through immunization process, and they call for population to be fully vaccinated. I'm talking about the adult population, and but not the adult population, but the whole population. So they want to have 80 or 90% of whole population immune or vaccinated. So these figures are quite high still, but for example, it is 9% less likelihood to be reinfected in Georgia, for example. And now we can so individuals are not protected to be reinfected. I have a question. There was a time over the globe where the number of vaccines was the problem. So there was a lack, less access to vaccines. That was the key reason for immunization process hindrance or impeding. It seems that nowadays it is not a problem around the world because accessibility to vaccines is very high. And my question is, what is the key hindering factors for countries to have a high rate of fully vaccinated individuals to be well prepared for winter, for example? What kind of obstacles do countries have currently, because now vaccines are more available? So I do agree with you that it is not a problem at all in the European countries. We have here countries with high income, with the average income, and with the low income. And we can say that in developed countries, it is not a problem at all. But as to the developing countries, for developed
გასაგებია რომ ინდოეთმაც მოახერხა მილიარდი ვაქცინის დოზის გაკეთება, იმიტომ რომ და ეს არის სწორედ ის მაჩვენებელი ბოდის მოუღის სულ რაღაც ორწუთიანი ის უნდა გავაკეთოთ რა.
Just so we please have 2 minutes break and we can continue our minutes within 2 months. My apologies for this discontinuation. It will take me only 2 minutes to continue.
უკაცრავად დიდი ბოდიშით უბრალოდ მომიწიანეს ლოკაციის შეცვლა.
My apologies once again. So we can proceed with our meeting. So the challenge is firstly in developed countries. Vast majority of countries, of the developed countries, have achieved expected goals in terms of immunization process. And by the end of this year, in order to prevent very severe outcomes in winter. As for some countries, some European countries, and as for the developing countries, for example, in Belarus, there is a key challenge pertaining to the delayed immunization process, also hesitancy to be fully vaccinated, also the political leaders' attitude not to kick off campaigns, different campaigns for promoting immunization process. Also, we have a lack of strategic communication in our country that hinders this immunization process, and because as soon as you create information vacuum, or this information vacuum is filled with anti-vaxxer movements, you know. That's why it is very essential to develop strategic communication plan in order to be able to manage pandemic-related challenges, especially during winter. Also, there are some other motivations there are some influencers who try to have certain influence on people's mindset. But as I'd like to emphasize the lack of strategic communication plan. As for the other countries, they may have some challenge regarding accessibility to vaccines. Also, it is the WHO's objective by the end of this year to achieve 40% of population fully vaccinated, and by June 2022 to have 70% of a rate of immunization fully vaccinated individuals. Also, I'd like to start my screen sharing again. And on this slide, if you take a quick look, you will see that the key countries that have certain challenges regarding immunization process. For example, we have here UK that had 60%, but there is 63%. Also, the same can be said with Germany. Also, the same challenges exist in USA. So these countries find it difficult to continue immunization process in population and to increase this 60% rate and to push or incentivize individuals to be fully vaccinated. So these figures remain stable, and we can't observe the increasing rate of fully vaccinated individuals. It seems that they, to a certain extent, they achieved the desirable or expected outcomes, and they stopped the communication campaign to solve this hesitancy. Also, there are some vaccine hesitance and the rate of vaccine hesitance is very high in France, for example. It amounted to 60%. And the COVID vaccine hesitant rate was about 60%. Also, how Italy and France managed to achieve this high rate. They were the very first that introduced also different kind of approach. Also, routine vaccination was mandatory in France, and there were very high sanctions for parents who vaccinated their children. You know, the number of vaccine creations was very high. But nowadays they create very maximum comfort for fully vaccinated individuals, and they introduced discomfort for unvaccinated individuals. For example, unvaccinated individuals are not allowed at their job places or at work. You can do a test, for example, once in 3 days, or you can submit your fully vaccination document. So this is a kind of approach that helps immunization process to boost immunization process. So they introduce some comfort and some discomfort for unvaccinated and vaccinated individuals. Also, we can see the different approaches also in other countries as well. In some countries, they introduce certain obstacles for unvaccinated individuals. Also, Biden requires certain to put additional effort to boost the immunization process, for example. Also, they get full authorization from Pfizer. And also there is legal ground for federal government to introduce mandatory vaccination for federal administration workers. Also, we can see that it was mandatory in healthcare for healthcare workers. Also, there were some attempts to introduce obligatory vaccination for teachers or for higher educational institutions as well. Also, it was very essential to have a status of fully vaccinated to continue your working, for example, and to not to be fired from work. Also, healthcare workers, we can call it a public experiment that was held in USA when New York state introduced mandatory vaccination depending on profession, and 50% of 15% of population of healthcare workers said that they would quit, but in fact we observed that this country introduced mandatory vaccination for healthcare workers, and this approach worked in this country. So one point is what people say, what they say, but on the other side, it is important how they act in reality. Some people may say that they will not be fully vaccinated, but when they face with this condition, they change their mind. That's why we need to fill these gaps. Also, some people are under other individuals' influence, and they think that it is not proper to be vaccinated. But all of a sudden, when they encounter these realities, they may change their mind. For example, nobody wants to quit their job, nobody wants to lose the income. That's why they are incentivized to be fully vaccinated. That's why we can see that there are different approaches that promote immunization process. I'd like to ask the audience so we can collect one or two questions. If there are no questions, we can give the floor to Tiko Tsomaya, who is a professor of journalism and communication. I'd like to kindly ask you, Mr. Zoid, to attend this meeting till the end, because we may have some questions for you, for example, regarding strategic communication plan. Please stay online. Now I'd like to give the floor to Tiko Tsomaya. Tiko Tsomaya is MD, PhD, professor of journalism and communication at the Georgian Institute of Public Affairs, Tbilisi. So she has a tremendous experience in healthcare sector. Tika, please talk about the media role in terms of promoting immunization process. What media can do in order to activate the immunization process? Tika, you have 20 minutes, and later on we will be joined by a representative of National Center for Disease Control and Public Health Stability. Thank you very much, distinguished Liga. I am very happy to be here, and I'm very glad to talk about this topic. Then this is very relevant indeed. I hope that we will have some discussion, or we will hear some reflections from our participants. I will try my best to talk about the role of media. What can the media do to activate the immunization process, and what kind of effective communication campaigns we can have in order to convince as many people as possible to get vaccinated. The objective of my speech is to have certain outline for journalists. What can journalists do in this situation? I will try to share my presentation as well. I will share my screen. I will skip some slides to not to provide you big information. Tico, I'd like to ask you to speak in a slow manner because we want to make this the presentation more understandable. I am Tico Tomai. I took this photo 3 years ago. You can see that there is a crown on my head. This photo was taken in Barcelona, and this kind of art element is our reality. And we know that this COVID pandemic changed our lifestyle. Also, our routine has been changed. The interaction, the type of communication with people has been changed. We lost certain part of freedom. For example, I am restricted to travel to Barcelona, and so we have had certain travel restrictions due to pandemic. So it is obvious and it is evident that COVID-19 has a certain impact on our life. Also, it has influence on the life for journalists. Journalists are the ones who are kind of frontline workers, and the journalists should provide this first-hand source information to public. It is very important to understand the role of journalism. So they are telling the truth. They explain some things, and journalists should bring truth to society in order to be able to make a well-informed decision. However, society plays an important role. What is the type of this society? If this society is concerned of their future, or for example, if society is curious about their future, and this society should have this necessity to make a well-informed decision. You know, we know that there are different types of society, different features of society. That's why we need to see the connection between journalists and the society. Also, there is a new media, kind of revolutionary ordinary kind of crazy media, we still call it new media. However, it is not new at all. We have new reality. How to say, you know, so the journalists are still telling truths, but it seems that any individual can be journalist, you know. So for any individual who spread any news or who spread any innovation can be called a journalist, because all individuals have opportunity to spread certain information, and this kind of approach to certain extent impacted on this profession and impacted on journalism. So we need to have better understanding of this profession. Also, we need to observe the trust level toward media. What is the dynamic of confidence level to media? And this is a figure of Georgia, and we can easily observe that this confidence level is decreasing as time goes by. And now let's see what happens regarding healthcare system. What is the confidence level toward healthcare system? We can observe here the fluctuation rate. So this is kind of confidence level toward the healthcare system nowadays. Also, confidence towards religious. They have high level of confidence, and this confidence level was reducing as the time went by. This is the figure from 2000 data from 2000 up to 2017. So we need to keep religious confidence level toward religious institutions in mind. Also, this is confidence toward information sources, and you can see the distribution of this trust toward different institutions. For example, we have here National Center for Disease Control on the top. Also, we have here the government, also journalists, media, and so forth. Also, as I have already noted, an individual is able to spread information. That's why there is a huge chaos, because there is a voluminous information, and to go through this information, it's quite challenging. I will talk about, briefly talk about the topics I was involved personally. I was involved in several surveys, and I will briefly share you my viewpoints. Along with my students, we observed in social media who was spreading disinformation or fake news regarding vaccinations, who were the anti-vaxxers, who spread disinformation, and what was their background, and what type of information they spread, and what was the dynamic about it. So, as Mr. Zoid mentioned, so definitely we aren't able to observe not all of them, but they were not too many, but we have observed them for 6 months, and we observed that they were very empowered, they strengthened their opportunities, they acquired skills, they perfected their ways of spreading fake news, and they acquired new skills to spread disinformation, and they applied social media for these purposes. So they posted some videos, they shared some videos, they posted some photos, they had some live streamings posted on social networks, and we observed that they were quite perfect, you know. And in opposite uh, and we, in parallel, we had the communication campaigns. Um, and I started this campaign during the second survey. I started the influencers who had certain trust. They are very popular in society. And I studied whether these influencers have certain impact on society's mindset and society.
და მაინც რა ხო ესე იგი ეს საინფორმაციო კამპანია რომლებიც გაავრცელებდნენ მტკიცებულებაზე დაფუძნებულ სწორ ინფორმაციას პროვაქცინასთან
Also,
ვაქცინაციის მომხრე ინფორმაციას
they
მეცნიერებაზე დაფუძნებული
also there were some other groups who spread some science-based information and so forth. Also, I'd like to share my experience where journalists and our societies, governments, politicians, and the influencers interaction. What was the interaction between these stakeholders? So I studied the situation from August 2020 to January 2021, and I studied the TV broadcasters, how COVID pandemic was covered by our TV broadcasters and by Russian first channel. And so we made this comparison, but due to time limitation, I will briefly mention key differences between these TV broadcasters. For example, Georgian public broadcaster was saying that COVID pandemic is very negative, and we should be scared of pandemic. However, our government, our politicians do their best in order to tackle this problem and in order to prevent this challenge. For example, the government ensures monitoring. The government provided some facilities. The government calls for population to get vaccinated. So the government is doing everything to tackle this challenge. So these were key messages covered by Georgian public broadcaster. So yeah, pandemic is we need to have certain fear. However, our government is doing its best. Also, and there, but it was quite ambiguous. This coverage was quite ambiguous, you know. On the one side, they were saying that we have increased confirmed cases, but on the other side, don't worry because everything is under control. Also, some economic backslash also kind of the media applied certain negative words to induce certain fear, but on the same time, this public broadcaster was saying that these responsible bodies and state institutions do everything to tackle this challenge. Tico, you were talking about Georgian public broadcaster, are not you? Yes, I'm talking about only Georgian public broadcaster. So this broadcaster was covering that government representatives try their utmost to resolve this challenge. So these very key messages spread in our society. So and there was a perception that the government takes care of us, and they were saying that our government was introducing European approaches, and they were saying that as it was recommended by a World Health Organization and so forth. It was kind of formulation of their statements. And so on the one side, we have kind of active population and passive population, And I will briefly talk about the first channel of Russia. First channel was quite unique indeed. The discourse was not totally different, there is a key figure who is able to do everything for us, who takes care of us, but it was very exaggerated, and Putin, everything was around Putin, and Putin was kind of king who issues the order to build the hospitals or clinics, for example, and the other politicians were working for him, for Putin, to please Putin, and Putin will do everything for us, and Putin will be a role model for other countries as well. Russia first channel was saying that our Putin will be exemplary for others, By the way, it was quite interesting that pandemic was called a war, and Putin is introducing or is developing certain weapons for this war, and in parallel Russia is assisting to other countries in combating pandemic. Georgian public broadcaster was saying, and despite the fact that we do not have vaccines at all, our media was saying that we will have vaccines soon and we will follow European countries' example. But as for Putin, as for Russian media was saying that, we will develop the vaccines by ourselves and we will cure our population, and how happy Russians are to have this key figure like Putin in our country. So it was a comparison between TV broadcasters, between Georgian public broadcaster and Russian first channel. Also, I selected these countries. I think Russia is not in this list, but I can tick it. I can add Russia as well. And before I find it, you can take a quick look at this slide to get information regarding the death rate. And we can see that there is a high confirmed death rate in Bulgaria, and Georgia has also very high rate of confirmed deaths. And Mr. Zoid properly described the situation before immunization process. Georgia manifested only 25%, and also there is daily new confirmed COVID-19 deaths per million people, and here is Bulgaria, and it is Georgia. So we can conclude that the situation is not good, and we have not a good situation. So this comparison was made between data about data to from 2020 August to 2021 January. So it seems that I have only 7 minutes, and I will introduce a few or several interesting points. I have just prepared it for you to show what media does and what are the best practice, what is the best practice for journalists to follow up. And this is internationally or widely recognized. These are mainly associations, you know. For example, Association of Healthcare Journalists. It is a very trust local competent association, because you see that for journalists it is essential to cover healthcare related issues or points, and this association became one of the leading ones, and a lot of people are joining to this association because they realize how important it is to cover healthcare related topics in a proper manner. And also I brought some, I collected some information about different journalists. I conducted a quite important survey, and I will briefly share you these survey results. So these individuals, for example, this individual, Alex Smith, and what he did, why he is considered as an exemplary. This was ordinary journalist, but when he saw that it was outbreak, pandemic, he collected data, he observed the official data, and he found out that the type or method of calculation of these figures was not proper. So the country was producing misleading statistics, and these journalists conducted journalist investigations, and based on his researches, it was evident that the method of calculation of figures or cases was not proper. And the association acknowledged him as the best journalist, and now he teaches the other journalists how important it is to focus on specific data, and how important it is to be oriented on one specific topic, and to understand the method of different approaches. Also, there is another journalist, Daniel Funke, and I will share what he has done. Sorry that I'm jumping from one website to another. Also, there is Marla Brodford, a very interesting journalist, and the association is saying that please draw your attention to his writings, and now take a look how interesting his stories are. If you read these stories, and if you read these headlines or titles, for example, targeted treatments for autoimmune disease make progress, masks protect school kids from COVID despite what anti-science politicians claim. For example, example, and teens and other volunteers help seniors find scarce COVID shots. Is it safe to delay a second COVID vaccine dose? Also, we can see that there is a diverse topic, and so these stories are quite diverse. And so it was very surprising to me to see this diversity of these stories, and these journalists offer a wide range of topics, and they tried to write about different interesting topics. Also, Marla Broadwood, another journalist who produces quite interesting statistics and conducts these very significant surveys that enable society to be well informed and to make well informed decisions. For example, this is another journalist who covers different topics and shares the trusted sources and saying that these sources are very relevant, and if you create some scientific surveys, you should know that there are three very important sources you need to be focused on in order to get new information and in order to spread this accurate information to society. And he gave us this link. Also, there is the sciences, engineering, medicine. So in total, we were given 3 links, and I will share my presentation later to you to have access to these links. I will distribute this presentation to you. Also, another interesting journalist, Tara Haile. If you want to be well informed, you should follow the journalists who focus on confident sources. You should follow these journalists on Twitter's account. I followed these journalists and I observed the way of their writing. So these journalists are Americans mainly, and they shared information. They share information that is very trendy, and I try to adjust this information to our country's reality. Also very interesting per individual Apurva Mantavili on this Twitter account, who is well respected, and she had very significant project about this pandemic, and she publishes very interesting articles also. Also, while talking about social media, what are the sources people use? So a lot of groups have been developed. About Us is very important resource where self-organized patients who had COVID, they managed to share information to one another, and through this platform, an individual is able to get interesting information. You can register on this platform, and you will have more opportunities to make your own decisions regarding the treatment, regarding rehabilitation. If you have if you tested for positive, what kind of decisions you can make regarding treatment and so forth. Also, I will finish my presentation with these 3 advice. Be super skeptic skepticism. You can put a question mark. Also, you should find the sources to which you trust and the sources that trust you also be easily accessible. If you do not find an individual, and if you do not get a response from this individual, you can be lost, That's why you can apply some social networks, Twitter and so forth, to follow these interesting individuals. That was all I'd like to note. Thank you very much, Tina, for your interesting presentation. Also, confidence level was very interesting. Also, you presented quite interesting resources, and we are very happy to have access to this presentation, as including links, and I will share these links to my colleagues as well. It is very essential indeed to find reliable sources, observe them, and apply the gained knowledge. It is very essential to put this experience into practice, to put this knowledge into practice. Now it is time to give the floor to Marina Topuridze, who is the head of the COVID-19 vaccination communication group in National Center for Disease Control and Public Health at Tbilisi, and she will talk about this vaccination communication group activities. What are the strategies? What kind of incentives we can apply to convince as many people as possible to get vaccinated, what worked in our country and what did not work. My greetings to one and all. Thank you very much for having me this webinar. I am partaking in a marathon, and we have a certain campaign for vaccination and for immunization process, and I am in a rural area. Within the framework of this marathon, we understand how media's involvement is very essential to raise awareness on immunization process. I will briefly talk about different steps. Within the framework of this marathon, we do not have maximum involvement or maximum civic involvement. However, we observe, based on our experience, to provide different services on the spot, especially in regions, also to involve healthcare workers in these campaigns, and it is very it is of utmost importance to share information and to share experience, and society see that it is not necessary to have ICU next to you. It is possible to have this to get vaccine close to your house, for example, in different medical institutions. I will share my screen. We know that COVID-19 pandemic was a tremendous challenge for society over the globe, including Georgia, and this pandemic affected the healthcare system as well as economy. It caused economic backlash, and public healthcare system was highly involved in this process, and the media played an important role in this regard as well. And that's why media's role is very priceless in combating this pandemic, and we can say that apart from healthcare workers, journalists play a crucial role in this the whole process. Also, there is mass media role that consists of 6 components, and I will briefly list these 6 components of mass media model. This is public health communication, also health education, strategies for social distancing. Also, there is reduction of stigma, discrimination and prejudice, telemedicine, and managing infodemics as well. For example, providing information regarding recommendations developed by WHO or a Ministry of Health. Also, health education is very vital as well. You are well aware that nowadays, not only for a general population, but for healthcare workers, so there are very interesting surveys, and based on these surveys, we can see that the social media was a key source of getting information. In post-Soviet countries, we have certain language barriers and different challenges as well. And due to these language barriers, it was difficult for healthcare workers to have access to patient management, disease prevention, and any other of sources in their languages. And in case of absence of language barrier, also we should have skills how to find reliable sources and not to be misleaded. That's why health education is very vital. Also, there is another component, namely strategies for social distancing, and we know that we introduced certain regulations, for example, to keep social or physical distancing, and media played an important role in this regard as well. For example, to raise awareness on these introduced regulations, what kind of restrictions there are for population. Also, it is very essential to explain the grounds of these restrictions or regulations. These regulations should be science, evidence-based, and so forth. That's why media plays an important role in explaining the grounds and the reasons for these regulations. Also, during social distancing, we have this type of communication. Well, now we're able to have some e-learning at schools. Also, we are able to hold online meetings and so forth. Also, media became a reason for stigma or discrimination and prejudice as well. And media highlighted the challenges in terms of ethnic minorities, and also there were some forms of discrimination covered by media and so forth. Also, for example, there was stigma in a certain region when an individual tested positive for COVID-19. That's why this person could have some stigma, and there were some conflicts in other countries as well. We also have another component of mass media model here, particularly telemedicine. We are aware that approaches for management is very essential, and we know that this disease is very complex, and it requires complex involvement, and it requires high experience. Also, we need to involve a few specialists in this process. That's why experience sharing is very vital. How to manage complex cases and how to manage the patients in a proper manner. Fortunately, we have a very good experience how to ensure expertise involvement in this process to ensure patients management. And disease management. And the latest and last but not least component of mass media model is managing infodemics. We know that from the very beginning of this pandemic, infopandemics was spread as well, that resulted in confusion within society, and it eradicated the trust towards healthcare sector and towards healthcare workers that had a very negative impact on the immunization process. Also, expectations were quite interesting while working on immunization process. We started working on this strategy. There was an expert team who covered potential challenges of COVID-19 vaccine. In general, we know that I personally am involved in vaccination communication since 2012, and this process is accompanied by different challenges, you know. For example, for children vaccination, for pediatric vaccination, we had some vaccine hesitancy, and the vaccine hesitancy was properly highlighted by Mr. Zoid as well. Also, there were other issues, COVID-19 related issues. For example, these issues were uncertainty regarding this virus, and this uncertainty hinders and hinders this communication, you know. When there is a high rate of ambiguity or uncertainty, vaccination or immunization process is hindered to a certain extent. Also, there was another issue, namely resistance versus demand. There was some debate how to start communication, not to cause some aggression from society, you know, and this expert team was involved, and this expert team discussed the methods of communication and the ways of communication, because there were certain individuals who wanted to get vaccine, but there was no vaccines available in our country. Also, if vaccines are not available in your country, the healthcare sector can lose confidence, you know. That's why we need to have it was quite challenging for us to have this kind of moderate communication to keep balance. Infodemic was another issue, and it was very large scale issue, you know, compared to other cases. And infodemic means that we have luminous information, including disinformation, and it is very challenging for you make distinction between truth and false. Also, it was very challenging, not only for population, but for healthcare sector workers as well. And these experts in our team, there were some experts who had direct communication with nurses or with other doctors as well, and there were some division of opinions, you know. So it was quite challenging to navigate in this voluminous information. Also, groups prioritization was another issue, and we developed certain strategies for high-risk groups to provide immunization process, and the healthcare workers were the first group prioritized. Also, there was another group, for example, elderly one and people with chronic diseases. These groups were prioritized as well. And we selected healthcare workers as the first prioritized group, and there were two sides, also part of doctors who had certain hesitancy and who did not want to get a vaccine. Also, there were another group from non-healthcare sector who had hesitancy and who had certain complaint that it is unfair to vaccine only healthcare workers and not average ordinary individuals or citizens. Another issue is multiple vaccines. You know, when people have multiple options, it hinders the decision-making process as well to make timely decision. And we have vaccines that were purchased by our state, and there are also some also this our population has multiple choices. That's why this existence of having multiple choices also hinders this immunization process, because it takes much time for individuals to make a final decision regarding the vaccine. And also it can be could be another issue. I mean, having multiple vaccines for population. For example, we have also some other vaccines, not only but COVID-19, but for example, for measles, and parents have these choices also. As for the challenges, I have also covered the challenges, but I will put emphasis on opportunities of COVID-19 vaccine communication as well. And potential drivers were fear of the virus, also wish to end restrictions. For example, wearing a mask is not comfortable at all. That's why it was kind of additional driver for population. They wish to end restrictions. Also, trust in health authorities. Also, recommendations from trusted sources. Also, wish to protect respectable others. And also in parallel with potential drivers, we have potential barriers as well. For example, a safety concerns can be considered as a key barrier. Also, lack of easy, equal, safe access to the vaccine. For example, it became evident, especially in villages and in regions. So when there are elderly population, for example, elderly family, and there is no access for public transport, it is quite difficult for these elderly people to get vaccines. Due to this low access to public transport, and for this elderly population, it is very hard to get vaccinated. Also, there is the barrier in terms of disinformation, and we do have this disinformation rate, high rate regarding this vaccine. Also, lack of trust of authorities and their recommendations. Quite interesting surveys are conducted, and in order to we have surveillance of vaccine acceptance, and perceptions in European region revealed high vaccine acceptance and relatively low resistance in Western European countries. It was more 85% compared to Russia, Belarus, Ukraine, Moldova, and Bulgaria. And before, it was less than 50%. Also, through these surveys, it became evident, it became possible to survey the vaccine acceptance. And this slide shows the findings of the surveys regarding vaccine acceptance and perceptions in European region. For example, in Western European countries, we have this percentage here. Now, as to vaccine hesitancy, we need to have a clear definition of vaccine hesitancy. Vaccine hesitancy is a delay in acceptance or refusal of vaccines despite availability of vaccination services. It does not mean that vaccines are not available or vaccination services are not available. Hesitancy means that people kind of prolong their decision-making process, and they refuse these vaccines. Also, this chart, this table showcase the majority of people accept vaccination. Several are uncertain and will have questions, and few people refuse. Also, we have here accept all, and the percentage rate is 30 or 40%. Also, there is another column on this table, accept but uninsured, and the percentage amounts to 35%. Also, there is another column, meaning accept some, delay and refuse some, and the percentage is up to 20-30%, and refuse but uninsured percentage fluctuates from 2 to 27%, and refuse all. The percentage is less than 2%. So we can see that there are different types of hesitancy, accept but uninsured, accept some and refuse some, refuse but uninsured, and refuse all. So we know that complex and context specific, varying across time, place, and vaccine. You know, some people may get vaccine, but they have certain concerns and they are not convinced in their decision and they are in need to be more persuaded or convinced. You know, we know that there are some people who accept some vaccines and who refuse some vaccines. That's why we need here a different approach to convince these people to get vaccines. Also, we task doctors to know their beneficiaries. You know, there are some people who refuse, but they are not fully convinced in their refusal. You know, refuse all percentage is less than 2%. There was anti-vaxxers up to 7%, you know. There's people who refuse all vaccines, but at the same time, they use certain propaganda to influence on other peoples as well to refrain from vaccination. You know, fortunately, the percentage rate of these anti-vaxxers is not more than 5% in all countries, and it is fortunate. And we are very lucky that we do not have high rate of anti-vaxxers. But it is very sad that they apply all ways and they use all ways to have influence on hesitant people not to get the vaccines, especially the ones who are not fully sure or who are unsure to some vaccines. I will briefly talk about the primary drivers of hesitancy and the primary drivers of this hesitancy. The first one is concerns about safety and side effects from COVID-19 vaccination, driven by the speed of the clinical development process and the vaccine's novelty. You know, they have certain doubts that in a very short period of time, it is impossible to develop safe vaccines because we know that it takes 10 years to develop vaccine. Also, the another primary driver of hesitancy is lack of knowledge. And the final, last but not least, driver is distrust in the political or economic motives of the government or corporations. You know, some people have certain doubts toward the government or corporations. They have mistrust toward these state institutions. That's why the people are very hesitant. For example, some people asked me, you know, how much money government gave you to visit us, you know, to convince us to get vaccine. And so I also am asked such kind of questions from people. How much I am paid to convince people to get vaccines. Also, there are other factors influencing vaccine safety perception and especially environmental influences. So we have social, cultural, community, and religious influences. Will it be in religious minority or also in Orthodox society? We know that, for example, I am a member of a Trinity Church parish, and we know that there are a lot of churches. And for example, my priest calls for his parish to get vaccines, but there is another church where priest calls for his parish not to get vaccine. You know, we know that there are different attitudes from religious leaders. Some religious leaders consider that it is unsafe to get vaccine, but some religious leaders call for their parish not to get vaccines. Also, people with also we have historical issues affecting trust. Also, we have people with the shared values and beliefs in tight-knit communities where ideas spread rapidly. And also, we know that we have high resistance. For example, some people refuse to test to do PCR test, you know, because due to religious leaders, you know, it's that's why good communication and awareness raising is very vital in our country. And we know that not only healthcare workers, but other bodies manage a pandemic as well. For example, local communities leaders manage a pandemic, you know. Also, there is historical issues affecting trust. We find it difficult to have communication with IDP communities, you know. Also, we have communication with international organizations working with vulnerable groups. Also, it is very difficult to work with people living on a low income, different kind of minorities, disabilities, or members of communities with inadequate health service access. Also, we need to provide key messages regarding behavior, for example, and the key source could be not only social network but TV broadcasters as well, and also there is mistrust to state, and there is high rate of skepticism. You know that, and this skepticism is deeply rooted in these communities because the government did not keep its promise, and that's why they have certain mistrust toward state institutions, and they do not trust the state institutions anymore because they did not keep their promises. Also, we have mistrust toward healthcare sector as well. It is quite challenging, you know, to work with people who have very bad experience in healthcare sector, you know, and we call them resistance mothers. When mothers have a bad experience with their children in healthcare sector, for example, these mothers these children may have certain diseases, and these diseases were not treated in a proper manner, or the children did not take relevant medical treatment, due to which these mothers lost their trust toward healthcare workers. So we have time limitation, and I will briefly ask you, you properly identified your target groups or with which NCDC needs to work with. And what do you think, how effective your communication with this population is? And we know that you developed certain tools and you have communication marathon, and you take part in this marathon in certain region. And how would you assess, are these methods effective, or how would you evaluate this method? So here I will finish very soon. We have very we have individual intentions toward COVID-19 vaccination, for example, to address questions, provide resources, depends on motivation to be vaccinated, social professional influences, and the availability and access to a vaccine, may have questions about potential side effects. Also, as for hesitating, when to listen and address concerns, facilitate access to evidence based information and the due newness of disease, novel vaccine platforms, and uncertainties surrounding vaccine safety and hesitancy is dynamic and can be influenced by communication with the trusted healthcare. Also, as for the rejecting, minimize the group size by good management of vaccine safety issues. Also, rejection often based on safety concerns, but experience, perceptions, and values could be involved. Also, anti-vax activists to reduce impact on other groups oppose all just COVID-19 vaccination, engage in protests, may source and share misinformation about vaccine safety, particularly via social networks. It is very essential to develop sustainable plans to work with these anti-vax groups because they intrude, you know, and also we need to call, we need to approach to law enforcement agencies as well to address this issue. Could you please share this presentation to me via email, and I will distribute this presentation to my colleagues because these topics are very relevant. Mr. Zoid, just two questions regarding the strategic communication. What is done for hesitancy in Georgia? What states did for this purpose? And another question is pertaining to green passports. So what barriers should the green passport include in order to work effectively in Georgia in terms of hesitancy, in terms of solving the hesitancy? What barriers should the green passports include in order to make it effective? Thank you, distinguished colleagues, for your comprehensive information. Please, Marina, stop sharing your screen because I want to share my screen. Please stop sharing your screen because I want to share my screen again. I think I stopped sharing. Yeah, it stopped. Just a minute.
ხო, ეს პრაქტიკულად წარმოადგენს ერთ-ერთ ვერსიას, აი თავდან
Maka mentioned and highlighted this topic. This is a broad spectrum of groups, people groups, for example, refusers. So we have here older acceptors, the deniers, skeptics, unconcerned, worried acceptors, and this is joint survey. And why I'm sharing this survey. This is distribution between unvaccinated individuals. This is the example of Georgia, you know. This survey was conducted in August, and also we compared this survey to March, and we found out that these figures have not been drastically changed. I mean, these different groups. The reason for this was that on the one side, we did not want to introduce very strict restrictions. Also we knew from communication plan that for the first 6 months we would not have vaccines available, and we applied social media for communication. We had certain trainings, social media managers, how to cover these topics, and we could allocate a lot of resources for this purpose to cover these topics in a relevant manner, and we did not do it. We did not invest in this work. We acknowledge, and we acknowledge this a problem. We can call them bots in social network, but it is very effective tool for you to spread desired information or to block undesired information, and the government could do it, not to have this kind of fertile soil for anti-vax activists. If the government did it, we would not have these deniers and hesitants. Yeah, we can. Our government can do it after election in the future, but there was a huge gap, and it was very difficult to fill this gap. Also, it is very challenging to reassure these individuals, because they have also very stable opinion not to get vaccines, and now it is more complex to reassure these individuals to get vaccine. But if we did it from the very beginning, we would be able to convince these people to get vaccines. Also, we know that the general communication is very important. Will it be via media or via social network, and so forth? But the strategic communication plan was not sufficient from the very beginning. And we need to. Unfortunately, some key principles were not followed from this strategic communication plan. Now, also, what can we do in the future? We have, for deniers, we have 12%. There is 2% amounting. We have 12% of deniers who refuse this immunization process. And we should prevent these individuals to be involved in kind of conspiracy theory. This is we have here 22%, and we need to work with these groups. For example, if we give them comprehensive answers for their questions, we will be able to convince them to get vaccine. Also, there are some people who are unconcerned about their own health and about their vaccine immunization process. And if person is unconcerned about his or her health, he will not be interested in vaccination or immunization process at all, because he is not concerned about his health. Also, we know that we have some people with chronic diseases, and we know that these people do not take care of themselves. They do not go for medical check. They do not go for screening, and so it seems that these people are not are unconcerned about their health. That's why it's quite challenging to convince these unconcerned individuals to get vaccine. That's why we need to introduce some comfort. We need to introduce some advantages for vaccinated individuals, and to introduce some disadvantages for unvaccinated individuals. For example, threat of losing job, risk of prohibition to have access to some services and so forth. That is very essential to give them clear messages, and we need to put all earnest effort to work on skeptics and to work with unconcerned groups as well. For example, there are some barriers in terms of reservation. Also, this campaign where Marina is involved, namely marathon, it is very helpful in terms of awareness raising and in terms of providing comprehensive knowledge to society to have all-embracing information regarding vaccine. So also there are some physical barriers, for example, public transport, time-related barriers, and so forth. Also, there are some elderly people who have some access-related challenges due to public transport and so forth. Also, we have here 33% unconcerned people. They do not take care about anything. They do not take care about society's health, including themselves. In this case, we need to introduce some drivers and incentives in positive and negative one. And positive is kind of incentive or award, for example, some praising, for example, we have also this lottery, and this is kind of incentive or driver for these unconcerned individuals. And on the other side, we have here involuntary approaches. Definitely, these involuntary or mandatory approaches really work. And the surveys confirm that this obligatory and mandatory immunization process works. And also, if we have these approaches, we will be able to have certain motivation for unconcerned people to get vaccines. Also, teachers, for example, some teachers say that if a vaccine immunization process is mandatory, I will get vaccine. You know, that's why if we have mandatory immunization for healthcare workers, for teachers, and for higher educational institutions, we will have high rate of vaccinated individuals. You know, we may impose some very strict punishment, for example, putting in jail or in cell, but I'm talking about alternative. For example, you can do tests yourselves, and you have to cover these test costs, and you should do this test once in 3 years, and you have to cover these costs yourselves, and these individuals will be finally kind of forced to get vaccines. Also, transport companies are involved in this process, and also hospitality business is involved in this process, and we can introduce some regulations in hospitality business as well as in public transport companies. And through these channels, we will be able to increase the accelerate immunization process. But you know, another point is enforcement. We need to have proper inspection to monitor or to supervise enforcement mechanisms in hospitality sector or in public transport and so forth. It is very essential not only to introduce. It is not sufficient to only introduce restrictions, but it is very essential to ensure proper enforcement mechanism. You know, if we want to achieve certain success by the end of the year, it is very essential to have this involuntary immunization for healthcare workers, for teachers, for lecturers. To have a proper enforcement mechanisms. Definitely the ones who work in healthcare sector or the ones who work in higher educational institutions should be fully vaccinated. So there are several mandates that I have mentioned that should be introduced, and gradually we need to extend the scope of this immunization process and to cover more and more groups in the future. Also, there is very quick question, and we can finish. Why not? Why the requirement of the public health law is not appealed, you know, which directly oblige the citizen to take preventive measures in the event of pandemic. You know, we need to appeal the law on public health that directly oblige the citizen to take preventive measures. That's why I'm highlighting that it is very significant to have a proper and relevant enforcement mechanism. You know, this law stipulates certain requirements, but if you do not enforce this law, it is nonsense, and these requirements are fully nonsense. That's why we need to ensure proper enforcement mechanism of these restrictions or requirements. Definitely, yeah, you know, there is an article, there are certain requirements stipulated by law, but we have lack of enforcement mechanism. You know, that's why we can introduce some mandates or some mandatory immunization for healthcare workers, so we can have decree of minister based on which it will become mandatory for healthcare workers and for teachers or for lecturers to get fully vaccinated, to be fully vaccinated. You know, if we have this additional mechanisms, so we will achieve more success in this regard. You know, also this law talks about the not outbreak, you know, but when we are talking about the immunization process, this law enables us to introduce different types of mandates through which immunization process will become mandatory. Thank you very much, dear participants, for putting your questions. Also, a lot of thanks to our distinguished speakers. Thank you very much for sharing this very priceless opinions regarding vaccination and immunization process. I'd like to kindly remind you to send me your presentations, and I will forward these presentations to my colleagues because it will be very valuable for us. Thank you very much once again, and wish you success. Thank you. Thank you for your attention.
მადლობა ლიკა.